Tension-type headaches. What are they and what are the symptoms? Tension headaches or tension-type headaches, as they were renamed in the first edition of the ICHD in 1998, are by far the most common form of headache, with some estimates suggesting that as high as 90% of all headaches suffered by people anywhere in the world fall into this category. Tension-type headaches are further broken down into two subcategories, episodic and chronic. The first of these would be defined as tension-type headaches that occur on less than 15 days in every month, whereas any headaches that occur more regularly than this over a period of at least 6 months would fall into the chronic category. With a tension-type headache, the pain can radiate from the eyes, neck, back, or indeed from any other muscles in the upper body. The pain is often described as being one of constant pressure, something that feels as if your head is trapped in a vice or between two bricks, and it is relatively common for the pain to be felt on both sides of the head at the same time as well. This is known as suffering from bilateral pain. Most commonly, a tension-type headache is likely to range from relatively mild to moderately painful, but sometimes, the pain can become severe or even extremely severe. What causes tension-type headaches? Until relatively recently, it has long been believed that tension-type headaches were generally caused by tension in the muscles around the neck area and in the head. For instance, it had long been suggested that a primary cause of tension-type headaches was excessive clenching of the teeth, which causes a serious contraction of the temporal muscle. However, more recent research has suggested that many tension-type headache patients do not have excessive tension in their muscles at all, so this theory now carries less weight than it did previously. Another theory that seems to have more credibility is the idea that tension-type headaches may have something to do with a temporary malfunction in the area of the brain which is responsible for sensing and controlling pain. The theory has it that due to some kind of malfunction involving neurotransmitters like serotonin, the brain misinterprets ordinary signals from the muscles as being pain, hence the presence of the headache. What is not disputed is that there are many different causes that can bring on headaches of this type. Amongst these causes are the following: stress, lack of sleep, eye strain, caffeine withdrawal, improper or bad posture, irregular meals, or eating food that triggers the headache. However, you should note that these are just the widely accepted and well-known causes that often bring on tension-type headaches, and that what actually triggers an attack in any individual can be as personal as the severity of the attack itself. In effect, every individual who suffers tension-type headaches will do so for their own different reasons. It is therefore imperative that if you are either an episodic or chronic tension-type headache sufferer, you need to isolate exactly what it is that is causing your problem before attempting to deal with it. For instance, many women will suffer tension-type headaches just prior to the onset of the menstrual cycle, often associated with premenstrual syndrome. In other examples, loud noises or bright, flashing lights can trigger headaches in some people, so there really is no way of listing every possible cause of tension-type headaches because every individual is different.